listening to the residents and the surgeons trash talk med students as a group. Hey guys, today we are recapping the surgical rotation, one of the med students' clinical rotations. I've got a list of pros and cons for you about the surgery rotation from my perspective and my experience. Then at the end, a short list of tips for you, things that I learned from being there and dealing with the personalities and stuff that made the experience less like you hear the horror stories about. I have this, it's upside down to you. I have this that we're going to be kind of tearing into here. If you're wondering, why haven't you opened this already before? It is because the surgery rotation's busy. Leave me alone. I've also got these. And how else am I supposed to build Lego plants except with surgical tools? I want to see if I can. So that's what we're going to do today while we talk pros and cons. We're going to be doing this one here, partially because it's the littlest. And this is the first time I've done this, and I don't even know if I can. Although you could argue that it's because it's made out of little butterflies, and surgeons are also special little butterflies that require delicate handling. This is the skin dupe that you're supposed to practice on, all the tools. We're not going to be needing this today. We are building a succulent. That's what surgical tools are for. We'll get some good use out of the forceps, tweezers for the uninitiated. I don't have anything sharp here in case anyone was worried about that. While we open this up, let's talk about our first set of pros and cons. Con, the hours. Even as a medical student, the surgery rotation has terrible hours. It's about 12 hours of a shift, not 6 days. What am I talking about? 5 days of the week. So every work week. If you're a resident, you don't get the weekends off, but as a med student, you still do, which is good because I might have died otherwise. So the hours aren't good. Pro, opposite to the hours, it sure is fun. Surgery rotation's more, well, there's some stuff about it that's not fun, but you have things you get to do. And it's kind of fast paced, and you get to see a lot of new and interesting things. Sure, I didn't practice my sutures very much outside of the rotation, but if you don't suck that much, you get to practice your sutures on patients in the operating room, and so there was a lot of that. Con number 2, surgeons can be kind of intense. That turns out to not be a rumor. Opposite to that is that the OR itself actually super relaxing a lot of the time. For the basic procedures, things like the cholecystectomies and the appendectomies that are done, especially the laparoscopic ones, the vibes are good. They turn the lights down so they can see on the screens what they're doing, and then they're routine enough procedures that there's a limited amount of stress compared to an emergency procedure. Actually, though, the emergency procedures I saw were pretty zen too, but there's just this chill vibe, just enough light to be working, and you get to help with things, so there's stuff to focus on. It's a chill vibe. It's so relaxing. Guys, the OR is so zen. I don't know if that's an abnormal take or not. I haven't asked anyone about it. That's just my experience. I loved it. I thought it was really nice. Next con. Some people might disagree that this is a con. I kind of thought it was. The material that you're working with on a surgery rotation is, compared to say internal medicine or even to your didactic years in school, a lot simpler. You're not trying to do serum albumin ascites gradients. You're not trying to do acidosis, alkalosis, and compensation and blah, blah, blah. You're not working with all that. You basically identify if they need your procedures, and if they don't, you're bye. Which means that the material to study is easier. That's nice in some ways, but when you're a med student and it's your first rotation, it feels like you're not learning as much. Next pro, opposite to simpler material, you do get to do more things. You get to offer some amount of tangible help. Even a student can hold a retractor or comfort a patient while they're being put under anesthesia, and those things are valuable. Next con, the surgery rotation kind of hurts your arms. I mentioned before how you spend a lot of time on the surgery rotation holding retractors. Yeah, you're always pulling back or up, and there's all these muscles that are engaged during it and stuff. But flip side, pro for surgery rotation is that it hurts your arms. it's kind of nice to feel like you were working hard and you're helpful. And if you're doing a good job of it and like actually like making a difference in the surgery, you get told things like how you're being helpful, and you actually get to like see that difference as well. One of the surgeons I was working with for an emergency XLAP that ended up having a bunch of stuff that was unexpected that needed to happen during the procedure, actually just like told me mid-procedure while I was holding up several retractors, and I had been for several hours, he said, your work is valuable. And when you're a student who knows nothing and has been anxious for a month because you're not helpful and you're in the way and the residents don't know what to do with you, yeah, it's kind of nice that your arms hurt and you get to feel like you're doing a good job. I liked it. Next con that was just something not surprising, just less intuitive than I expected, was how techy surgery is. Like, and I don't mean like the different surgical techniques that take skill to learn. Like, obviously those are going to be techy. I mean things like all the different kinds of graspers and all the different kinds of sutures, and because there's a lot of differences between those things, and they're not necessarily going to tell you all those differences. If you don't know that they're that different and you don't know to ask, you just won't know. So if you see somebody like making a choice, ask them why they made that choice. Then the flip side of that con, the pro, is that there's a lot of little like bits and bobs to play with and learn about and figure out how it's used and stuff. So if you like that kind of lots of like bits to figure out, little pieces to manipulate, tools to play with, it's going to be a good time. And I thought that part was pretty fun. Sometimes it got a little overwhelming when you're like trying to figure out what they're doing in the middle of a procedure, or like which tool you're supposed to be using when they tell you to do something, or like you need a tool and you only know what it looks like and not what it's called, but everyone's busy, so you have to like figure out how to ask for it. Yeah, but it was fun mostly. Okay, last con, the big bad things that happen during surgery rotations. That's where you're going to see serious injuries, big traumas. So just go in knowing that you could see something pretty rough. Go in prepared, eyes wide open. The opposite pro to that is that you're gonna feel pretty cool about being able to get through those and to help the patients get through those. You feel very capable, helpful. It's all good things. All right, so as promised, also have several tips for you about like things to do during the rotation to kind of help you out. The first tip is to learn your surgical diseases that pop up pretty regularly early on. Those were like appendicitis, cholecystitis, cholelithiasis, choledocholithiasis, pancreatitis. Surgeons love to ask about pancreatitis. If you can explain the difference between like a biliary pancreatitis and all the other causes of pancreatitis, not just scorpion stings, you'll probably catch a few questions that other students don't answer as thoroughly. Tip number 2, prep for your procedures. Know what you're doing, why you're doing it, and the relevant anatomy. They're not going to ask you questions like, how do I do this really specific type of suture? They're going to teach you that kind of thing. What they are going to ask you is questions like the layers of fascia that you're going through for a specific procedure, or what tests you're doing to monitor things while you go along. And the thing is, you don't have to be like perfect at it. You just have to like demonstrate that you've shown effort. Try to answer. If you don't know the answer, tell them. If your surgeon's not one of those notorious psychopath ones, you're going to be fine. Number 3, another way you can show interest and engagement is by asking questions. And don't just like, what's this that I'm looking at? Ask them more in a way of like, is this the thing that I read about? Blah, blah, blah. Is this part of the small bowel? Or is this the large bowel? Is this whatever ligament? Just, like ask them specifically and try to like contextualize it with the information you already know. It's going to be more useful to you than having, for example, every single resident on the service tell you again where close note is if you've already been told it one time. So like build on that and whatnot. On the flip side, next tip, read the room. Don't do all the question asking when there's a bazillion things going on and the residents are busy and the surgeons are trying to teach the residents and all that kind of stuff. You're just going to get on people's nerves. I will tell you though, this is bound to happen. It happened all the time to me. The surgeons and the residents won't always make it really obvious when they are busy with something. Sometimes it looks like they're not doing something, and then like you walk up and ask a question and they make a face, and mostly they're like nice people, so they're trying not to be like, get out of my way, you're annoying. You can see on their face that their concentration was broken and they're not too pleased about it. Luckily, most of them are kind about that, but just, it's gonna happen sometimes. Apologize and, oh, if you don't have time right now, I can come back later. communicate like an adult, which is hard when you've been locked in a basement studying acid-base disorders for 2 years. But now's the time to practice. Get back to it. Tip number 5, use what you do know. This is the context for like when the surgeons are asking you questions during procedures, or if the residents are asking questions during rounds, or whenever you're being asked questions, you won't always know the exact answer, but respond with what you do know. An example of this, I got asked a couple of times about like the major types of bacteria that cause appendicitis. I didn't remember like number 1 is this, number 2 is that, number 3 is that. But I remember that E. coli is a common one. So I answered, oh, I think E. coli might be one of them. And they're like, yeah, that's the top one. And then I was like, oh, and gram-negative rods, because I was like, enteric tract, of course. And they're like, yep, what are some of the gram-negative rods? And that's when I drew a blank. And that was their like, okay, well then like go look some of those up moment. And when someone tells you to go look something up, just like do it. You've been doing that for 2 years and your didactics, like, you're fine. Don't be embarrassed about it. Like the whole point is for them to teach you. So just like engage with what you do know so that they don't see you as knowing nothing. You're not on like a question game show where you have to hit the button and answer the exact right thing to get the point. You get points for trying and bringing up what you know, and those kinds of things stand out. So be chill, talk about what you do know. You're welcome. Tip number 6. When you are asking people where you're supposed to be, what you're supposed to be doing, etc., don't necessarily like take their word as gospel for the next time. Ask each person in each OR what their preference for each thing is, because there is enough variability that the rules in one room are not going to be the rules in the other. One surgery tech is going to want you to get your own gloves and your own gown. The next is going to strongly prefer that you don't, because they don't trust med students and want to get them for you. Just ask. When you walk in the room, be like, hey, you're the surgery tech, hi, my name is blah, 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 nice to meet you. What do you prefer I do about gloves and gown? They'll tell you. Most of them are really nice. Some of them, I've heard the stories. I know that they're not all nice, but most of them are. So just know that like when you ask one person, it's not necessarily going to carry over to the next, and that you're going to have to ask again instead of just taking that as the procedure. Every new room you walk into, ask, because that way you won't mess up in anyone's eyes, at least as often. You are a med student. You're never not messing up in some people's eyes when you're a med student. Nothing quite like standing around the OR, listening to the residents and the surgeons trash talk med students as a group while you're just sitting there like. Last tip, if you actually do want to learn some of the more detailed aspects of surgery, like doing the sutures correctly and how to use the tools and stuff, the people to ask are the plastic surgeons. Some of them are apparently kind of uptight, so say the general surgeons, but they're going to tell you what you need to change to get your sutures just so. And I don't know, I had really good experiences with the plastic surgeons, so highly recommend. Those are all my tips for you. And we've got our special butterfly surgical rotation Lego flower pot all set up here. So let me know if you want to see any more of these. I've got a lot more rotations left to cover, so thinking of building one of these for each one, maybe with the surgical tools, maybe not. We'll see. Let me know. Got it. Oh, it's the dirt. It's the dirt that goes in the pot. Okay. Hello. Please hold. Check this out. I don't know if I did that right.